करते हैं तो second day the person has a very irresistible desire to eat. So the results have been eyed with suspicions. They have seen the religious fasting which people practice. They result in transitory weight loss, but the effect on biomarkers is still something which varies. However, what is important is that data is lacking regarding the effect of intermittent fasting on other health behaviors. They have not used the behavior, the diet pattern, the sleep pattern, the physical activity. These have not been incorporated in all the studies, and there is no data where they have used this intermittent fasting regimens with clinical outcomes like diabetes, cardiovascular cancer, chronic disease or Alzheimer's, because all the studies have been of very, very short duration, 4 months, 5 months, 1 year. So maximum they have done is for 5 or 6 months. So, but these are all chronic disease. So you cannot very surely say what will be the effect, but yes, intermittent fasting is the new. But what are the challenges today? As I said, we have an ingrained culture, you have an obesogenic social environment, and it is very difficult to maintain this. You have a withdrawal rate of around 30 to 40%. You have to manage your social life, you have to go to a party, you have to eat, so you are not able to maintain your fasting duration. You need very strong motivation, and especially no binging. That snacking thing which we do has to be avoided. So what is basically why this intermittent fasting is not adhered is because, first of all, it has to start from our families. Parents have to lead by example, which I think we should start, because we just heard how we have to go for healthy aging. So I think if we start, our sons and daughters, they'll also follow. That education has to be provided in the college. You have to make this, because this is very much relevant, because this is the world of advertising. So much advertising coming on the media, internet, television, newspaper. They have such an empowering power on the brains of the adolescent that they will not think about intermittent fasting. So you have to bring it in these programs have to be initiated, the research has to be initiated, and rather we should say the physicians have to be trained to tell the patient, yes, you should follow this regimen. Because हम लोग अगर patient को ये कहेंगे तुम fasting शुरू कर दो, कहेंगे तो तुम्हारे पास क्यों आना, better go to some Ayurveda or some natural healthy healers or something. So basically we have to train our physicians to develop this type of the thinking, and obviously for this we require the support of a dietitian, we require the support of a psychologist who can keep the patient motivated, and this is how the rehab facilities also have to be provided. So I just conclude, whether intermittent fasting is a strategy, it surely works for some, as with any diet, but the question what the person needs to ask is if it is right for them. Do I enjoy doing it for forever? And if answer is no, then intermittent fasting is not their panacea. So I end it by saying less may be more. Thank you. Sorry, it has been a big presentation.
Thank you so much, ma'am. Your expertise and passion for this subject have inspired us a lot. I request our esteemed chairpersons to say a few words in appreciation of our speaker who has just completed an enlightening session.
Thank you, Dr. Jyoti.
Hello, check.
Thank you. So, thank you, Dr. Jyoti, for this very informative talk, and you have really put it very beautifully. And I think what to eat is important, but when to eat is also equally important. And you have correlated the molecular concepts with the intermittent fasting very beautifully. Thank you so much.
Once again, thank you, ma'am, for taking us through your lecture in detail to the journey of all the molecular and cellular level to get that concept. Once again, for me, this is not the easy way of doing this. So, and now you see in this, WHO also has come in the picture that most of our newer generation are going to be obese, right? Obesity. So, keeping in mind this, there are new fashion has come up, that is keto diet.
Keto diet.
Right. But keto diet, there are so many side effects are there, right? They say that minimum 50 gram per day carbohydrate is enough for to take these challenges. But don't you think that, ma'am, there are a lot of stress body have to go through, which you have already talked in detail. But I just want to take from your depth of knowledge. Like, can you please enlighten us that whether these keto diets are good for us, or which age group can follow? Because our newer generation and world is taking care of that threatening of this obesity. Yeah, ma'am, please.
They have tried to compare this keto diet with intermittent fasting, but they have not found any extra beneficial effect of the keto diet, this keto diet over intermittent fasting. The major advantages of intermittent fasting being that it helps you to maintain your lean body mass, which is very important for maintaining the endurance of your muscle, which is not there in the keto diets. Moreover, some people have keto diets, they have certain issues, but with intermittent fasting, the other the side effects of the keto diet, it is overcome with the intermittent fasting. So that is a very advantageous part of the intermittent fasting, that the person, and that is why the newer generation, they are now shifting to this intermittent fasting, because they have a feeding period during which they can eat whatever they want. And then they also, just to satisfy themselves, they are fasting for 12 hours, they are eating anything for 12 hours. So what they did was, they were comparing whether when you are maintaining the eating interval for 8 hours, 12 hours, 14 hours and 16 hours. So for your fasting, if you are increasing for this. So what they found was 12 hours, obviously no benefit. The metabolic adaptations were there. You are able to lose some weight, but some adaptations, your body, the sensors were more mitochondrial biogenesis was occurring, and all the benefits you were attaining. But that benefit which is helping your cells to become more resilient was more evident, even if you are doing it 12 hours. And if you are increasing it to 14 hours or 16 hours, the benefits are much and more evident. And most importantly, intermittent fasting, because it is according to your circadian rhythm. It follows your circadian rhythm, so that you can say you are centering your peripheral clock with the central clock. These all your periphery ke sensors are, you are aligning them with your central sensor. So this is the major reason why the youngsters are preferring the intermittent fasting nowadays and over the keto diet. The keto diet, it has its own problems, it has its own side effects. So people are they are shifting on to intermittent fasting, because you have no restriction what you can eat. But yes, if you combine it with the healthy eating, the benefits are much more evident.
Thank you, ma'am. One more thing, I just want to give it to you here from my small of journey in this field. Being a physician, being a dietitian, that what I give my suggestion to my patients, those who are diabetic and all, I just say, instead of that going for the for intermittent fasting and keto diet, can you do that? Means whatever the amount of calorie you consume from your diet. So for example, if you are taking 4 chapati, that don't take that 4 chapati at a time. So instead of that taking at a time 4 chapati, can you divide this 4 chapati in the timed gap, say 2 hour or 3 hour gap, and then you consume. With this practice, ma'am, really my patient has improved a lot. They have come up with this suggestion. Sir, thank you so much. But that there is no evidence of scientific. So once again, thank you for giving us another opportunity in the research, because lot of gaps is there.
Lots of gaps.
Lot of gaps.
I have already mentioned those gaps, yes, because they have all been done in health. Obese, already the patient is having a deranged metabolism.
Correct.
And then they are doing it on them. They are not doing it on the healthy population.
Exactly. So once again, thank you so much. I would like to ask any of our audience if you have any questions, please, to ma'am.
Any question, please?
I think they have already gone into the fasting phase. Rather, your cognitive faculty should be improved now. शुरू हो जाती है within your, it is has to be 8 to 10 hours, your glycogen starts, it starts depleting. अब snack मत लेना ना, stop snacking, stop your 3 meals. Rather, if you stop eating 1 meal, they say you are somehow following this intermittent fasting. You skip 1 meal, and I would not say breakfast because he can understand. Skipping breakfast is never an option.
Exactly.
It should be at the, and what they have done is that time restricted eating, they have shifted. They have also done studies कि अगर आप early morning restrict करते हो, you skip the breakfast, or you do it in the late evening. The late evening was found to be more beneficial effects. So they always say don't skip the breakfast.
So there is a lot of things are coming up. As ma'am has already told that lot of things. Now new things has come up like eating. This especially this time after break 4 to 5,
Yeah.
right? You consume lot of biscuits. Through biscuits and tea, lot of calorie you are taking. Instead of this biscuit, what they have started taking water fruits. That is what you call makhana. And makhana, that is what it is now big fashion, and this all our Bollywood and Hollywood stars they have started taking this. So what they do, that makhana contains of the very
Lot of
less
calcium.
calorie and other calcium nutrients. The micronutrients rather help. So please, instead of this all chips and all kurkure, so please replace these things with the scientific.
But one thing what I have seen is observed in my friends and families, they are eating those makhanas, but then they fry it in desi ghee. So all that benefit is lost. They'll do a toss.
Yeah.
भाई हम सिर्फ toss कर रहे हैं सिर्फ एक बार, because that is inherent, especially in this northern belt, that Punjabi culture you can't get off without that ghee taste in your mouth. That is what I am talking about. So what they do, मतलब the benefits. So rather you should go on for the grilled or the baked ones, the makhana. But then yes, they are the you can say the superfoods. They have been included as superfoods, and lot of, I think what we have seen over there in today's conference, lot of things which are helping us improve our metabolism, our lifestyle, how we can improve to improve our health. Basically, I think very informative and I think it's really going to make us much wiser, and probably we are going to improvise some changes in our lifestyle. Thank you.
Thank you.
Now it's time to honor our renowned speaker. I request our respected chairpersons to present memento to Dr. Jyoti Sethi ma'am. Now I request Dr. Manjeet sir and Dr. Naresh sir to present memento to our respected chairpersons. Thank you so much sir for joining us today.
ये ले लेना।
Who's the next speaker? मेरा ही ना?
Yes, ma'am. Ma'am, ये chairperson है.
अच्छा अच्छा अच्छा.
Can we have just a minute? Can we have a photo? Yeah, photo. Thank you, sir. Thank you so much.
Thank you so much, sir. Following our insightful session on autophagy and intermittent fasting, we now shift our focus to another essential aspect of well-being, that is mindfulness meditation, often referred to as the windshield cleaner of the mind. As we navigate the complexities of modern life, the practice of mindfulness meditation provides sanctuary for quieting the mind, reconnecting with the present moment, and nurturing a greater sense of self-awareness and compassion. To chair this session, we have Dr. Manisha Sankhala ma'am, who is an MSc in medicine, PhD in medicine, and currently working as an associate professor in SMS Medical College, Jaipur. Please welcome Dr. Manisha Sankhala ma'am on the stage with a huge round of applause. We are grateful to have Dr. Poonam Punjabi ma'am, who is a lifetime member of Association of Physiology and Pharmacology, APPI. She is the member of Endocrine Society and has a professional teaching experience of 19 years. We are privileged to have Dr. M. Shobita ma'am, who is a professor and head of Department Physiology in School of Medical Sciences and Research, Sharda University, Greater Noida. She is also a FAIMER Fellow, that is, Foundation for Advancement of International Medical Education and Research, USA, and Christian Medical College, Ludhiana. I welcome ma'am on the stage to share her deep knowledge with all of us.
Okay, thank you, ma'am. So a very good evening to all of you. I know you have been bombarded with so much of information on intermittent fasting, yoga. Okay. So I'll go straight away into my presentation. So the objectives of my presentations are, my topic is on mindfulness meditation, a windshield cleaner of the mind. So these are my objectives. What is mindfulness? What are its components? How to practice it? What are the studies we have done and some recent studies and the take-home message for it. So, anybody from the audience, what is mindfulness? So, after all these presentations from morning, I want to ask a question. So, how is your mind now? Are you in this state of mindful, or shall we venture into this state? Is there any difference between these two images? Little bit of unclogging in the second image. At least in the image you are able to appreciate it. Okay. So, coming to this basic question, what is mindfulness? Anybody? Can you just give me your inputs as to what is your understanding of mindfulness? There's so much on how we have to eat. We keep eating 3 meals and then we also keep binging. So, is this related anyway to that? Can we apply this, incorporate this? Yes? Okay. So mindfulness, it begins its roots from Buddhism, some around 2,500 years ago. It's the English translation of the Pali word sati. So its definition is keeping one's complete attention to the experience on a moment-to-moment basis in a very open and non-judgmental way. So who brought this process into our mainstream of medicine? It was Kabat-Zinn. He was a professor of medicine. So he was the professor of medicine who brought mindfulness into the mainstream of medicine, and he developed this mindfulness-based stress reduction. So if you ask me how the definition is, it's the awareness that emerges by paying attention on purpose to the present moment in a very non-judgmental way, experiencing it moment by moment. So if the question is mindfulness popular process? Yes, mindfulness is a very popular process now, and these are the array of research work going on in the last decade. So I would like to begin with a very small exercise so that you understand these 5 core components of mindfulness. So there's something called as humming technique. We'll just do it for 10 minutes, and then I would like to wrap up my presentation as early as possible since this is my last. So let's just begin with this activity. We'll just close our eyes and just make this humming sound. Can we all do it for just 5 minutes? Please close your eyes and let's just try it out. Close your eyes and just make the sound. You can follow my voice. Please close your eyes and do this for just do it as loud as possible, please. Continue. And when you make this sound, pay attention to the vibrations in your chest. Pay all your attention to the vibrations in your chest and the body. Please continue doing it as loudly as possible. Now close your eyes and please pay attention to all the sounds around you. Just for a few minutes. Don't open your eyes. Please pay all your attention to all the sounds around you. Do not sleep. Pay attention to all the minutest sounds happening around you. Pay attention to the birds chirping. Pay attention to the wind blowing. Pay all your attention to all the minutest sounds around you. Do not lose focus. Try to listen to all the minutest sounds around you. Yes, now slowly bring your attention to your breath. Do not open your eyes. Feel the air entering your nostrils and leaving your nostrils. Pay attention to all the minutest sounds around you and start feeling the air entering and leaving your nostrils. Just do it. Do not sleep. The air is entering your nostrils, leaving the nostrils. Pay attention to your chest and abdomen moving up and down with every breath. Be attentive. Pay all your attention to every breath entering and leaving your nostril, and pay all your attention to your chest and abdomen moving up and down with every breath. Pay all your attention to every breath entering and leaving your nostril. Pay all your attention to the chest and abdomen moving up and down with every breath. Okay, now you can all slowly open your eyes. Yes, can anybody, give me some feedback about any change which you observed in yourself? I know it was a very short session, but I just wanted to give a taste of it before, I go into these abstract terms. Yes, ma'am. Yes, it was very...
It was very calming.
It was very calming.
Like everything stopped. All the thoughts that were racing, they just stopped.
Okay.
It was good.
Thank you.
Thank you, Dr. Shobita.
Okay. Anybody wants to comment about how you could relate to your thought process? Was it just happening or it just totally down? You could just see the thoughts coming and going, floating. Was there any change in that experience, any of you? Coming and going. So did you feel associated to it or less associated? Or was it the same?
Associated, madam, associated, and mind was wandering. Like we were coming back to this place, and again, it was very quick to go somewhere.
Somewhere else. Okay, right. So now we go into the 5 core components of mindfulness. So as ma'am has said, yes, there's definitely a relaxation process happening. But for that relaxation to happen, these are the 5 core components of mindfulness meditation. Attention, open awareness, acceptance, no identification, and choice. Attention, open awareness, acceptance, no identification, and choice. So let's go into each one of these. So what you did was you just paid attention to what occurs in this moment. Tried at least. Though we were not 100% successful, but we